It's Monday, and that means it's time for a new episode of Interviewing People, the careercast where you can learn about a variety of careers from people actually doing the work. Today I'll be talking with Kailey Gilliland, who once walked these halls and is now a sonographer at Wood County Hospital. Kailey will be sharing about her journey that includes an associate's degree, working with expectant mothers, and much more. So enjoy the show. Welcome back to another episode of the Interviewing People Careercast. And today we have Kailey Gilliland with us, and she's going to be talking to us about her career as a sonographer. And technically her official title is Registered Diagnostic Medical Sonographer, and she works at ProMedica. And we're going to hear her story and how she ended up where she is today. So Kailey, thank you very much for agreeing to join us. And I'd love to hear a little bit about when you were in high school. Was this a career that you always thought you would pursue? What led you to this, so forth?
Yeah. Well, thanks for having me, by the way. And yes, so I believe about my sophomore year in high school is when I discovered this career path. And then I kind of just never changed from that. Really liked it. When I did do the shadow day in high school, that's when I definitely really fell in love with it, actually being able to see it hands-on. I still remember to this day on shadow day, when I was sitting in the back corner watching them do the ultrasound, the very first patient that I had seen get her ultrasound done, she was actually finding out, I went to an OB office, so she was actually finding out the gender of her baby at that ultrasound. And she already had two girls. And so for this third one, she found out she was having a boy. And she just started crying. The room was all emotional. And then that's just kind of when I fell in love. I'm like, yep, this is what I want to do.
That is a great story. So yeah, that's awesome that
Yeah.
you remember that this many years later, that
Yeah.
that had that big of an impact on you. So when you left high school, you went to the University of Findlay. Can you talk a little bit about the degree that you earned and why you chose Findlay? Did you look at any other schools?
So around here locally, the University of Findlay does have an ultrasound program as well as Owens. The reason I chose the University of Findlay though was because the Toledo campus, the Toledo Owens campus is the one that offers the program, not the Findlay. Just me and my personality, I'm more of a homebody. So that's a huge reason why I chose the University of Findlay. And I actually was the University of Findlay has an excelled ultrasound program. So I did get my associate's degree, but I actually was able to finish it in a year and a half, just a little bit shorter. And the difference between the University of Findlay and to Owens, from what I've heard from other fellow sonographers, the difference and a huge difference is the clinical rotation. So the University of Findlay, they do their clinic rotation. You have one site that you go to, and my site happened to be Tiffin Hospital. I really liked Tiffin, but you stay there for the whole, I think it's 16 weeks if I remember right, or however long the clinic rotation is. Where Owens, you actually go to multiple hospitals, multiple facilities. You do your rotation in 6-week increments or maybe 3. I honestly can't quite remember what they've told me. So that's kind of something to take in consideration, how you would like your schooling to be done. If you're okay with just a one site, getting to know their schedule, their routine, it's awesome. I really liked it at Tiffin. As opposed to going to Owens, you'd have a lot of different experiences, different types of offices to go to. And yes, I did get my associate's degree. I did, to be completely honest, just didn't want to go to school for 4 years, just where I was at in my life, my personal life and stuff like that. And the difference between associates and bachelors in the ultrasound world is the bachelor's sets you up to be able to teach ultrasound if that's ever anything that you want to do further on down the career. And so as far as skill level and knowledge, there's not a difference between associates and bachelors. It's just whether or not later on down the road you'd like to teach it, which would be definitely awesome. But you can also go back for your bachelor's too. So that's why I chose the path I did.
Well, yeah, that's really interesting that, yeah, if the skills that you need to do the job, and if an associates will give you that information, then yeah, why spend that extra money and extra time,
Yeah.
get out into the workforce, and then, like you said, if you want to go back later for the bachelor's, now you have an income to pay for that,
Yes.
and you can avoid debt and everything else. So very, very
Yeah.
interesting. So on your LinkedIn profile, it talked about you being skilled at obstetrical fetal neurosonograms and fetal echocardiograms and assisting with amniocentesis procedures. So a lot of big scientific words there. Can
Yes.
you tell us a little bit about what you do as a sonographer?
Yes. So actually, while I was still in college, while I was still in school finishing up my clinics, I had a job offer to go to ProMedica Toledo Hospital, the maternal fetal medicine department, which is in the OB side of things. MFM are like what we call like the big dogs. So they are very knowledgeable when it comes to diagnosing abnormalities, whether it be fetal or dealing with maternal maternal issues as well, like diabetes, hypertension. If mom was born with like a heart defect or anything like that, that warrants them as high risk pregnancies. So a normal OB office, like in Findlay area, if they're doing an ultrasound and they happen to see that something's a little off with the ultrasound, something doesn't look right on baby, then they send it to MFM. They send it to maternal fetal medicine. So right out of the gate, that's where I headed. It was a little intimidating, but I learned a lot and I learned it all hands-on. So the fetal neurosonogram, that's ultrasound of the baby's brain. So while the baby is still in mom's belly, in the womb, they do an ultrasound of the brain, and it's a lot more detailed as far as you look at so many different cerebral structures. You measure things, stuff like that. That's a little bit later on in pregnancy that's done, because that's when the brain's nice and grown. The echocardiogram, that is the fetal heart. So we look at a lot of different heart views, a lot of little heart views, checking to make sure that the blood's going the way it's supposed to, that there's no breaks, no holes, nothing like that in the fetal heart. And a little side note, cool thing about that is when we do these, a lot of times it's around the 20 to 24 week in the pregnancy. And the baby's heart is about the size of a quarter at that time. So it's just amazing what ultrasound can see. And we know when a heart is that small, and you can pick up abnormalities, you can pick up blood flow changes, things like that.
Right.
And then amniocentesis, that is when they take a sample of the amniotic fluid inside of the belly, inside of mom's belly, where the baby is like encased. Yeah, encased. And the reason that they do that is to do even more precise genetic testing, to make sure that it's not the placenta that's throwing off some genetic testing, and to make sure that it is coming straight from the baby. And it's just it's more specific, and you can definitely get some more solid answers. So yeah, that's those three things that I do, or that we do. And that's up in Toledo. And I really like it. I like the challenge. And actually, probably should update my LinkedIn. It's been a hot minute since I've done that. Currently, just recently, I actually did leave ProMedica to come a little bit closer to home, and to cut back on my schedule a little bit. So now I work at Wood County Hospital, the women's care there. And I work there about 2 days a week, just because now I have kiddos and stuff like that. I wanted to kind of step down a little bit and be a little bit closer to home, because I do still live here in Van Buren. So the commute was a little crazy. But I was at ProMedica for a couple of years. And like I said, straight out of college. So I learned all of that hands-on. So
Right.
It was,
Right.
it's a little intimidating, but
Yeah. So, when thinking about what you do, you are someone that you're looking for those problems that so that if you do find any, you can send those to a specialist and then that baby and mother can get the help they need as early as possible to make
correct.
sure that everything's going to be okay. And so obviously a very significant role that you play in all of that. And,
Yes.
there have to be some times where maybe that's a difficult job too, because I don't know if you're having to talk to mothers about, hey, here's something we see and so forth. Is there anything else that maybe people don't expect that would be difficult about this career that is something that, you have to deal with quite a bit?
Yeah, so it is definitely emotionally challenging because technically us as sonographers, we cannot diagnose anything. I mean, we are taught what to look for, and if it looks like this is what it is. For example, like Down syndrome, there are certain markers that we look for on ultrasound, so we normally have a pretty good idea. Um, but so that does pose a challenge because especially at the maternal fetal medicine office, they already have an idea that there's something that's going on because they were sent to a specialist for a reason. So a lot of times they would already kind of have an idea of what was going on. The office would tell them why they were being sent. So then they would ask us like, are you seeing what they're seeing? And it's, like we can say, well, yes, things are looking similar, but it's not like we can say this is what it is. And so then, you definitely have to deal with sometimes first time parents finding out something traumatic like that going on with their pregnancy, with their baby. But it doesn't matter if even if they're not first time parents, it's still just as emotionally challenging. So you definitely have to have compassion with this career. I could not even tell you how many hugs I've given new moms, how many times I've had to give tissues to the dads. It definitely can be a roller coaster ride. But then on the other side of things, it can also be extremely exciting for them, finding out that they are pregnant, finding out what they're having. 'Cause we deal a lot of times with patients who like go through IVF, which is, in vitro fertilization. So they've had troubles getting pregnant. Um, and so then that's always exciting too. We follow those moms pretty closely because we have to see, like we have to do their ultrasound every so often to like see like when's the right time to do the procedure, things like that. And so you see them probably once a month, if not twice a month. And then when they are actually pregnant, it's so exciting. And, you're like their little cheerleader. So definitely things that I didn't quite know going into the career that you needed to be that way. Which, I thankfully am like that. So
Right,
it
right.
worked out. It worked out. But that is definitely something to take into consideration. If you can emotionally handle someone's, craziness that's going on in their lives, then it's a good suit for you, just like anything in the health field and the medical world, I guess.
Right. With all of the education you've had already, I also noticed on LinkedIn that you do have some certifications, and we've talked with the sophomore class about how certifications can either stand alone or they can be stacked on top of degrees or other certifications. Can you talk a little bit about why you've earned the certifications you've earned and what those have allowed you to do beyond what you might be able to do with just a degree?
Yeah. So with ultrasound is fairly similar to nursing as far as you finish all your clinic and then you have to take a state board test. And so mine is obstetrics and gynecology. So I went more of the OB side of things. And so I had to take a state registered test to become diagnostically registered in that. So technically I'm not registered to do to like scan someone's liver. Yes, I have the capabilities. So I learned it in school and I definitely can. Okay, hold on, I take that back. I can do it, but an employer wouldn't necessarily want someone who's only been in the OB world. If I was applying for a hospital job where that is where they do the liver, kidneys, they wouldn't quite really want me because I haven't really done that for the last, 5 to 6 years, but I do know how to do it. And so I would just have to then get my degree, my certification, take my state board test in that to be able to become registered in that as well. With ultrasound, there are a lot of different avenues that you can do. You can do the OB/GYN, which is what I did. You can do abdomen, which is where you look at the kidney, the liver, the spleen, the pancreas. You can also do breast, which is pretty specific. You can also do vascular. I never had any interest in vascular, but some people love it. And then like Nicole Miller does ultrasound as well. And that's her favorite. And her and I always talk. I'm like, you're crazy. But anyways, you can also do echocardiogram. So then that's when you just focus on the heart. So that's another thing that I absolutely love about ultrasound is, say in 5 years, I get tired of doing the OB world. My knowledge and my college experience allows me to, all I have to do is take a state board test. And it's not that I can't get any jobs with just my OB. But like I said, an employer would want to see that you've taken that. And a lot of times they'll give you, like, if you get hired in, they'll give you like a year to get that state test done. And so then some of the other certifications that I have are more just OB/GYN specific. So like the clear, that's for like being able to do certain cervical lengths. So that's more just like specific to that. There might be more like specific certifications for like abdomen and echo. I just don't quite know those.
Right.
So yeah, like there's so much learning to do in every avenue of ultrasound. Like I said, you have about 5 to 6 main avenues that you can take. And then within those, each avenues, there's even more certifications that you can take as well, just to broaden your knowledge and, and get you more credentialed. So.
Right. And having those options is good. Like you said, if you get tired in one aspect, you can always move to another and you still have a lot of good opportunities there. So
Yes.
I noticed also that you are still involved with, it looks like, some organizations at the University of Findlay that are related to your sonography training, so forth. Are those things that, do you feel like a lot of sonographers are part of organizations like that? And what do those organizations add to your abilities?
Again, kind of similar to nursing, we have to also as sonographers do continuing education. It's called CMEs. I don't know what the stands for, but we have to complete those like every 3 years. We have to have about 60 of those completed. So just being involved in organizations like that allows us to be able to earn those credits easier. And just the sonography world is fairly small too. So it's kind of nice being in those organizations. So you know where everyone's at, keep in touch with local sonographers and things like that. As far as helping with the job, I mean, they don't quite play a role in that at all. It's just more or less just, I mean, I guess it does as far as getting the continuing education. It allows you to do that. But if you don't join any associations and things like that, I don't think it would affect you too much.
Right.
Those are just kind of ones that I had joined when I was in college. Like, college kind of just sets you up, tells you, it's a good idea to do that. So you do it.
Right. Well, and like you said, building those relationships also, that always helps. And that kind of leads to my next question is, who is someone that has played a role in helping you get to where you are today that's been influential in your life? And that could be college, it could be now in your professional world, it could be that person you shadowed.
Yeah.
Do you have someone like that?
Oh yeah. I honestly could probably rattle off about 5 or 6 people. The girl that I did shadow on shadow day, I ended up taking her position because I work at Wood County Hospital, but I also work per diem at Blanchard Valley. And I actually ended up taking her position at Blanchard Valley. She's the one that has like the My Little Me in Ottawa. So it is a small world. It
Right.
really is a sonography world, which is again something that I absolutely love because I'm a homebody. So, just like small communities. And you definitely do want to make good connections. I mean, not even just in sonography, but just in your career in general, because so Wood County and Blanchard Valley, I got both of those jobs from previous people that I worked with at MFM. So definitely don't create any enemies when you're in the work field or in college, anything like that, because, you know, they can come back to help you in the end. So that's something I've definitely learned. Both the jobs I have now have been thanks to, the relationships I created at MFM. Um, but one specific person that stands out to me is Sue Perry. She was the clinic director at the University of Findlay, and she kind of like became like my mom. Her and I were really close, and she was actually the one that helped me get the job at MFM while I was even still in college. She really recommended me, and she had really good ties with the girls at MFM because she used to work there. So so she was able to put in a good word for me, help me set up my interview, things like that. And she just treated me really well throughout college or throughout, my college career anyways. And so her and I still keep in touch a little bit too. And I definitely owe a lot to her because she was the one that kind of got my career going. So
Right.
that was awesome.
Right. So those relationships again play a big
Yeah.
role in everything. And talking about you getting that start up in Toledo, even while you were still working toward your degree, is that typical? Is there a high demand for sonographers? What's that job field look like?
Yeah, so with all the different avenues that you can take with your sonography education, whether it be abdomen, vascular, echocardiogram, anything like that, it does open up the door a lot. And I think a lot of other modalities are starting to really dive into the world of ultrasound. I don't know too much about this, but I have heard of them now using it for like vein tracing to be able to like help start IVs and things like that. So I do think the world of ultrasound is definitely growing. Um, as far as there being a job like right there while I was still in college, that was kind of not heard of. I know it took so I only graduated with 6 girls. That's how small our program was at the University of Findlay. And I think about half of us had a job within the first like 3 months, but then the other half, it took about a good year to get a good solid job. But they also lived um, in different areas. It wasn't all Findlay. Some went back down to like Cincinnati where they originally came from. I know one girl moved out of state. So that changes things. But I definitely do think that there's a pretty open field out there. Even Nicole Miller, like I said, she's doing ultrasound. She just works right down in Lima. Um, and especially with, kind of now how the world's a little crazy, the
Right.
medical field, it definitely has open availability.
Right. 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 Okay. Well, good. That's good to hear, and good for students to know that there are some good options there. So,
Yeah.
as you think about yourself back in high school, and now you look at yourself as a professional working, is there anything you wish you had known as a high school student that you now understand today?
Well, I definitely think that the associate's degree, because that kind of had me worried, like at first I really did want to get my bachelor's, that was my dream. But then, life happens, got engaged, stuff like that. So then I kind of just went back to, I'll just do my associates and I can always go back to bachelor's. But then once I was done with it really didn't make too big of a difference. So I would definitely say to those who are maybe worried about having a lot of student debt or anything like that. In the world of sonography, you can go for 2 years and you will be fine and you'll have all of the knowledge that you need. You won't have to worry like I did about, you have to have that 4 years to be able to get that job. That's not true. I'm a prime example. I had my associate's degree and I got to work with the big dogs right out of high school or right out of college. So not high school. So I think that's definitely something that I would tell myself if I was back in high school, like don't stress about it. Don't worry about it. You know, God will always take care of you and get you there. But in the world of sonography, what I'm going for, that's not it's not a big deal. So
Good, good. Yeah, I think that's really good for, again, students to hear, because we often do put that extra emphasis on a bachelor's degree, or, you know, and get what you need to do what you want to do. And then again, if you want to just go back later for more, you can always do that. But,
yes,
you know, don't go deeply in debt when you don't really need to, or
yes.
whatever the situation might be.
Yeah, and a lot of times a lot of times people would always tell me too, like a lot of times your employer will pay for your schooling too if you want to go back. So that's always an option too. Just never an option I've ever looked into.
And yeah, that is very true. Yeah, a lot of employers will pay for some of that. So anytime someone else can pay for it, that's always a win in my book. So
Yeah.
so if anyone's interested in a career in sonography and would like to reach out to you, I'm going to put your LinkedIn profile at the end of the video. Is there any other way they might be able to reach out to you, by email or something along those lines?
Yeah, email for sure. That's probably one of the quickest ways to get a hold of me, just because it goes straight to my phone, which I always have on me. So yeah. So email, really any social media. I'm on Facebook and Instagram, so you guys are more than welcome to follow me on there. And don't be afraid to reach out to me. I have had actually like 3 or 4 people, not from Van Buren, but that have like come to me to like get questions and things like that as far as ultrasound, because it is a small community, so there's not a lot of us out there. So yeah, feel free to reach out to me anytime. I'd love to answer questions and love to get you in the small community that we have of sonographers.
All right, perfect. Well, Kailey, thank you very much. Very insightful. Thank you for everything you've shared, and good luck as you continue in your sonography career.
Thank you.
Thank you for watching this interview with sonographer Kailey Gilliland. I hope you learned valuable information from her career story, and to be sure you don't miss upcoming interviews, please click subscribe so you'll know when the next episode is released. Thank you for watching, and as always, remember the best part about Mondays is interviewing people.